This has been legal since 2018.
What is an advanced medical directive? There's also another term that keeps going around called a living will.
That's right.
Can you tell us what these two terms mean?
Sure. So a living will and an advanced medical directive are essentially the same thing. They are
Okay.
just different terms for a document, a legal document, which is now in India finally legally valid, through which you as a person, an adult person who has the ability to make decisions about their healthcare, you can decide the kind of treatment that you wish or don't wish to receive at a time when you actually lose decision making capacity.
Right.
So, typically your doctor would ask you what kind of treatment you want. You would be able to refuse or agree on the spot. But there are medical conditions, as you know, where that capacity is lost, but you may still want that autonomy to extend even at a time when you can no longer communicate.
I'm actually going to pull out the directive on my phone.
Sure, please.
I'm going to use the one that is there on the Vidhi Legal Policy website.
Yeah.
And look at it. And this is a 7-page directive.
Right.
There is quite a lot to read.
Okay.
So I think that, as you said, the first
Yeah.
step is just read through it without, trying to fill it up or
Right,
any of those
exactly,
things.
exactly.
Now, in this,
Yeah.
it is written that I direct the withholding or withdrawing of the following medical procedures.
Right.
And there is a list of medical procedures.
yeah.
I'm going to read out some of them.
Sure.
And this is the ones where I have to say yes or no.
Exactly.
Correct?
Exactly.
I want this, tick yes.
Absolutely.
I don't want this, tick no.
Yeah.
So there is cardiopulmonary resuscitation or
Right.
CPR.
Yeah.
There is intravenous fluids and medicines,
Yeah.
including antibiotics,
Yeah.
excluding those that provide pain relief.
Right.
There is dialysis. There is ventilation or artificial life support. There is chemotherapy. There is surgery.
Right.
There is artificial nutrition and hydration, which is feeds or fluids through a
Exactly.
stomach tube or
Tube,
a
yeah.
nose tube.
Yeah.
If my family takes me to the casualty,
Yeah.
they will show them this
Yeah,
advanced
exactly.
medical directive.
And draw their attention to these
To
particular
these points,
treatments.
my
Yeah.
doctors are
Yeah.
first required to decide whether I am in a terminally ill condition
That's
or
right.
not.
Exactly.
If not, I receive the medical treatment in accordance with what me and
Standard
my family
medical.
want.
That's right.
But if it turns out that this is a terminally ill condition, then they will adhere to these things. So then if I have said no to CPR, no to dialysis,
Right.
that means that I will not get CPR or dialysis.
Right. I mean, there is still, again, because given this is all laid down by the court, there are still two more components to this process. In
Okay.
that you do, even if you have made an advanced medical directive, and even if you haven't made an advanced medical directive, the process by which doctors sign off on not providing you that life-sustaining treatment is a two-step process. So at the first step, there is a board of 3 doctors, 3 experts who come together and decide whether these conditions exist, terminal illness, and second, the fact whether this treatment would benefit you or not. If they sign off on that, then it goes to a second set of experts. Again, 3 doctors with 5 years experience each, one of whom is nominated by a district medical officer, who will again make the same determination. And once that's done, then you finally take this call on life-sustaining treatment being withheld or withdrawn. And I want to be clear that this is the process that applies whether you've made an advanced medical directive or whether you have not. So, and this is where the Indian system, the Indian legal system is perhaps slightly different from how advanced medical directives are used in the West, because the fact of making that advanced medical directive counts as the, really the final
That is
expression
the
of the
be all and
patient's
end all.
wishes. Exactly. And I mean, apart from the doctor doing some checks to ensure that there is nothing, flagrantly wrong about that directive, or the conditions that the patient are in meet those criteria, that's where it ends. But the court, in its infinite wisdom, has decided to lay down this process again for those
like
reasons
a-
of trust and suspicion that we.
But yeah, two-step verification, no? OTP. You need 2 steps, so it's 1 and 2.
The confusion is that, okay, if you've made an AMD, all of this doesn't apply to you.
Okay.
If you've made an advanced medical directive, that's not what happens. But Because otherwise, what's the point of making an advance medical
Exactly.
directive, right?
Yes.
The idea here, though, I think is, again, the court is thinking that you've made an advance medical directive, at least it imposes a duty on the doctor to decide what to do in accordance with your directive. So their decisions are also guided by what you have laid down there. And more importantly, perhaps, and is that you have a clear person to go to get consent for not providing that treatment, because you have mentioned those healthcare powers of attorney. So frankly, currently in the Indian context, the value that an advanced medical directive adds is that it provides some reassurance of your own wishes as a patient to the treating team and to your caregivers, and it provides a clear name and a hierarchy of people for the treating team to contact.
So there is context, there is responsibility.
Yeah, this brings me to another key component of the living will, is that you should nominate at least 2 persons in that living will who can exercise, who can make decisions on your behalf at a time when you lose that capacity. Again, people who know your preferences, who know your values, who you have discussed your treatment goals with.
I can give this living will to family or friends so that they are also aware of what I want, and
Absolutely. You should, in fact, the people who you have nominated to take those decisions on your behalf, you should certainly hand a copy of it to them. And if you have a family doctor or your treating physician, it's advisable that they keep a copy as well.
And when you said that there are, you should appoint 2 people,
right,
who know your medical preferences.
Exactly.
Are these 2 people also named on that living will?
Yes, absolutely. Their name, their details, because there should be a way to contact them so that your treating physician can reach out when there is a decision like that to be made. And preferably they should be named in order of preference. Yeah, so that they know that the first person to contact is XYZ, and if they're not available, then.
But I also want to sort of do a segue and discuss about when does the living will come into effect.
That's right. I mean, the fundamental one from the patient's perspective is that it comes into effect when the patient loses the capacity to make decisions about their healthcare. So up until the point, I mean, you may have made a living will or an advanced medical directive, but up until the point that you can make decisions, you can communicate with your treating team, that's
you
fine.
Will communicate.
You will do that, and you may be communicating things that are contrary to what you said in your advanced medical directive, but that's okay. What will have primacy is what you're saying at that point of time. It comes into effect only when you lose that decision-making capacity. And the second condition, at least in the Indian context, and again, given what the court has said, is that it comes into effect when a person is terminally ill or, is in another kind of medical condition where there is no hope of cure or recovery.
Do I need to be ill to make a living will?
Not at all. You can be perfectly hale and hearty and be having morbid thoughts and say, okay, no, I am, or be thinking philosophically about how you want to die and make one. There is no
I can be
reason.
well, I can be ill.
Yeah.
I just need to be of sound mind.